My name is John Mattingly and I have esophageal cancer. I wanted to make a video about my experience with this cancer because I found you can get lost in all the information you can find on the internet. To quote my dad, when you read information about this cancer and those who have had it, you can literally make yourself sick because of all the many sad stories. Of course, there are plenty of happier stories, but when you have cancer, I have found it's very easy to get the sadder stories to stick to you a lot easier than the happier stories. For me, it would have been nice to be able to hear and see someone who's going through this type of cancer, as it would have put more of a personal touch to their experiences as I try to relate it to my own experience. So here's a little about myself. I'm a 45-year-old man, happily married, and 2 amazing adult children. I have been with the company for 22 years. I also play drums in a popular local band. Physically, before the diagnosis of esophageal cancer, I felt pretty good. Over a year ago, I had just finished a journey of losing over 70 pounds, and the point about my weight actually became a factor in this cancer, which I'll explain a little bit later. Somewhere between Thanksgiving and Christmas in 2014, I started noticing I was having a hard time swallowing food. It didn't matter what I was eating. It seemed that I had to force it down my throat, and even got to the point of having to drink a lot of fluids when eating just to get it to go down. Prior to Thanksgiving, I don't recall having this issue. If I did, it wasn't significant enough to notice yet. Anyway, this went on for several weeks until I was concerned enough about it that I told my wife Lisa about it. Lisa just happens to work in my doctor's office of internal medicine as a billing manager. I was due for an annual physical anyway, so we scheduled an appointment with my primary care physician, Dr. Nan Monahan. When I went to see Dr. Monahan, she asked great questions about when the issue with swallowing started, if there was any pain from trying to swallow, when I noticed it started, etc. She was very concerned, so she referred me to Dr. Randy Yonda, a gastroenterologist, and Dr. Yonda performed an endoscopy, and when Lisa and I spoke with him after, he let us know that I had Barrett's esophagus and that my esophagus looked very angry, to quote him. It was inflamed, and it was one of the worst he had ever seen. He had taken a biopsy of some of the spots on my esophagus that he thought could have been cancerous. Several days later, I got a call from Dr. Yonda in my office where he let me know I had esophageal cancer. Anything going on at work at that point suddenly didn't matter. I sat back in my chair for a few minutes trying to absorb the bomb that just got dropped on me. Oddly enough, the emotions washing over me really had nothing to do with me or the fact that this could kill me. I found I was more concerned with having to tell those I loved and what this could do to them. After a few minutes, I made the call to my wife Lisa, who was also at work. Once the words left my lips, there was a bit of silence as Lisa was in instant overwhelm and moved to tears. It absolutely killed me, to say the least, because I could do nothing about it. Dr. Monahan and the staff at her office tried to comfort her as much as they could, but it just was too much. She left work not long after hearing the news from me. Lisa and I met at our house. After talking about the diagnosis a little and calming down, we knew that the next step had to be to let our children know. Our daughter lives almost 2 hours away and is going to college, so I called her and asked her if she could meet us at a restaurant for an early dinner. I never just call like that and asked to meet, and talk with her, so she knew something was up, and it was almost enough to make her sick. I had planned on looking her in the eyes, being as strong and positive as I could be, and tell her what was going on. But halfway through telling her about the symptoms, I just cracked. I just couldn't hold back the tears. The words sometimes came out as a mumble, and I could see this was tearing her apart hearing these words. When I told her I had cancer, she sobbed and couldn't take even looking at me for a bit. She went on to tell me it was because she was afraid that the cancer was going to take me away from her. Basically the same fear that my wife and son had when they learned about it. Next after that was to let my parents and siblings know what was going on, who are all in Oklahoma. We called my parents, let them know what was going on. My mom had just gone through breast cancer a while before this all happened, so she was keenly aware of the cancer experience. She and Dad flew out to visit and were part of some of the follow-up visits to doctors that was coming. The visits with the doctors were very sobering, as they basically all echoed the same thing. I have cancer. It's too soon to tell the kind of prognosis I have, and that there were great strides made in cancer research, so I had a reason to believe that I could beat this. There was also the stark reality that cancer is very personal and individualized, meaning that each person can react differently to the medications and protocols that are used to fight the cancer. The plan at this point was to travel back to Oklahoma to see my siblings and let them know what was going on. I was not going to do that over a phone call. As it turns out, we went back during the week of my 45th birthday. But the night I arrived, I let them know what was going on. It felt like I had sucked all of the air out of the room when I told them, and it broke my heart to witness the emotions that poured from each of them. I am the oldest of 9, and used to being the caregiver, which I have done my whole life. But this time, I was the one needing the care and support of my family, and it was harder than hell to leave them and go back to Georgia. I made it very clear to my family and a few co-workers that I told of my diagnosis that I didn't want this broadcast to anyone. It was my wish to instead keep this limited to a few people for now, for a few reasons. First reason was the fact that I wanted to learn more about the prognosis, because I would surely be asked that question when someone found out I had cancer. The other is because I didn't want the pity party. It's not my intention to offend anyone or minimize the effects of cancer when I say that. It's just that I have, for most of my life, been a very positive and motivated person, and as such, I didn't want the constant reminder that I had cancer to be part of the conversations or the look in their eyes when I would engage them. I knew at some point I would want to share my story, but I wanted to do it when I felt I was ready to. Now, I mentioned before that my heavier weight had a part of the cause of my cancer. When I was at my heaviest, I weighed 311 pounds. I had been heavy like that for a number of years and had constant issues with chronic acid reflux pretty much every night. The acid from my stomach would come up through my esophagus, mostly when I was in bed at night, and would often end up going into my lungs, up in my nose, or in my mouth. Many nights, I woke up choking from the acid. But after I lost about 70 pounds, the issue with the acid reflux disappeared, and I haven't had an issue with it since. I've had minor heartburn a couple times, but that's about it. So the acid from my stomach coming up into my esophagus first caused the Barrett's esophagus, and then elevated to cancer. I had a scheduled appointment with a surgical oncologist, Dr. Charles Staley, at the Emory Hospital in February. When we met, Dr. Staley said the news was pretty much that a surgical option was not possible. In PET scans that had been performed prior to our visits, Dr. Staley found that cancer had hit some of the lymph nodes. It was spotted in a lymph node in my left collarbone, in my abdomen, and around my esophagus. The lymph node in my left collarbone is very close to a primary artery, so surgery would be very dangerous to perform at that location, as I understand it. Also, if the cancer could not be completely eradicated from my esophagus, then there would be the chance of it going into my body if they tried removing my esophagus through surgery. So the next best alternative was for chemotherapy and possibly radiation to shrink or eliminate the cancer. After Dr. Staley's appointment, we were scheduled to meet with Dr. Perry Ballard, an oncologist at Piedmont Cancer Center, in March. I'm very much a person that wants to go straight to the point with no sugarcoating, and Dr. Ballard was great at giving it to me straight. I asked the obvious question about prognosis and the possibility that this could mean an early death, and Dr. Ballard was very frank in his words that based on his experience and his years in oncology, response to treatment of cancer is very individualized. He said that each person responds differently to treatment, and he didn't give me a sunny day scenario to try and make me feel better or get my hopes up, and I appreciate that more than he knows. Dr. Ballard let me know that I was diagnosed at stage 4. He also let me know that, generally speaking, the people who usually get this kind of cancer are much older than I am, usually in their 60s or older. He also let me know that there are some very positive treatment protocols, and that although my type of cancer is considered rare, they're finding great results with certain types of treatment. The chemo I had included a chemical compound called 5-FU. It also contained a chemical called oxaliplatin, which had some side effects such as neuropathy, mostly in the fingers and toes. It also can cause fatigue, nausea, and sensitivity to cold, like when you touch something cold or if you're in a cold place. The neuropathy is one of the side effects that the medical staff is very concerned about, and will ask about it for each visit. I personally did not actually have neuropathy, but I do have the tingling in my fingers and my toes. In my experience, I didn't really have any nausea, but did experience some of the fatigue and sensitivity to cold. When I would touch something cold with my hands, it actually felt like that biting feeling when it's wintertime and you hold something really cold. I also felt tingling in my toes, my fingers, and the bottom of my feet, and some sensations in the roof of my mouth and on my tongue. I also found that it affected the taste of just about anything I ate or drank, and because of that, being able to put a grocery list together for more than a couple days worth of food was hard, because I never knew what sounded good to eat from day to day. I still ate, but I just found it harder and harder to find things that sounded even a little bit good at the time. For you cancer patients, I can't stress enough that you need to eat, even when you don't feel like it or if nothing sounds good. Your body's nourishment is very important to maintaining the energy you need to make it through the treatments. The other part of my treatment was something that really excited Dr. Ballard, and it's called Herceptin. The chemical was FDA approved in the late 90s, and lots of the research, trials, and treatments utilizing Herceptin have been documented. For quite some time, it was a primary use for breast cancer treatment, but is now used for other types of cancer treatment. From what I have learned, one of the characteristics of Herceptin is that it can target the HER2 gene in cancer, which makes a protein called a HER2 receptor. HER2 receptors are like ears or an antenna on the surface of all the cells that receive signals that stimulate the cancer cells to grow and multiply. Herceptin literally targets and blocks those receptors in order to slow or stop the growth of the cancer itself, while the other chemicals fight and kill the cancer from the outside in. Potential side effects of Herceptin can be reduced blood flow, or in some cases it can affect the heart. So regular checkups and echocardiograms on the heart is necessary while taking Herceptin. I started chemotherapy treatment in March 2015 and was scheduled for 8 treatments. First, I had a port surgically installed in my upper chest underneath the skin. This port is an alternative to receiving the treatments through an IV in your arm. From people I have talked to who have gone through chemo treatments without a port, they had veins that collapsed due to the chemicals in the treatment. The good thing about the port is that when it's accessed, the chemicals will flow through the port and through a tube which is connected to an artery. So before each treatment, I would use a cream prescribed to me called lidocaine. I applied it to the port, which would basically numb the skin and the nerves around it. This way, when I went in to have my port access, meaning they would stick the needle connected to the device that will be connected to the chemicals into my port or through my skin, I would barely feel anything. After my port is accessed, blood is drawn via the port and then immediately taken to a lab to verify measurements of my blood platelets, white blood cell count, etc. Overall, almost all of the measurements stayed where they needed to be within normal range. However, my platelet count, which was at 220,000 before the chemo started, was 76,000 on the final treatment. Now it has grown and come back a lot since then, and will normalize eventually. One of the things that blood platelets do is clotting, so if it's getting low, it makes it easier to keep bleeding if you cut yourself, which I found out when I had a small nick on an knuckle of one of my hands. I was told that for the most part I could continue with life as usual during my chemo treatment, and that's pretty much what I did. I continue to go to work and be around people. I continue to play with my band on a number of gigs, and for the most part haven't been slowed down. For the most part. I have had a couple of band performances I played where when we were done I literally had nothing left. But it's important for me to keep going as much as I can, but also be smart about it and not push it too much. Before each gig with my band, I would nap and rest my body so that I had the energy I needed, and I did the same thing with family outings. So I have been glad to keep things pretty much business as usual, and I even got to keep my hair. So on the day of treatment, after getting my port accessed, having a discussion with Dr. Ballard and his team, we would go to the Piedmont Cancer Treatment Center to receive my chemotherapy. I was given a very comfortable chair and then hooked up to receive the chemicals. The treatment took roughly 3 hours or so, and while I was connected, I would connect my work laptop up and we would work while we were there. After I received the chemicals from my treatment, I was given a pouch, fanny pack if you will, with a pump that contained more of the chemo treatment and would continue receiving the chemo chemicals for the next 2 days. After 2 days I would come back in the cancer center and they would disconnect the pump. This type of treatment happened every 2 weeks for 8 treatments. I experienced amazing results during my treatment. The first treatment I had was on Wednesday, but by the following Monday, the issue that I had with swallowing was completely gone. I could literally eat food without the need of constantly drinking liquids behind it in order to get food to go down. Also, after about 4 or 5 treatments, I went back to see Dr. Yonda for another endoscopy, and he said that the results from my endoscopy were amazing. The top portion of my esophagus actually looked normal again as the cancer was gone, and the 2 tumors at the bottom of my esophagus had actually shrunk dramatically. In 2 follow-up PET scans, the cancer that had spread outside my esophagus and into my lymph nodes and also what was in my esophagus was no longer showing up. And the biggest news of all came from Dr. Staley when we were asked to come back for a consultation. If you recall, the surgery option was pretty much not an option to remove the affected areas. However, the response to the chemo treatment was so good, to quote Dr. Staley, it was rare, and now the opportunity of surgery was back on the table. During my treatments and follow-up with Dr. Ballard, he recommended that we consult a radiation oncologist named Dr. Fred Schweibold. It's common to include radiation as part of a cancer treatment plan because the radiation is known to be able to treat at the molecular level to shrink or kill cancer that chemo may have missed. After our consultation with Dr. Schweibold, we agreed that radiation would be part of the plan once chemo was complete. I completed my 8th and final chemo on June 24th and started radiation on July the 8th. I completed 28 treatments of radiation. For the 5 weeks it took to complete the radiation treatments, I also wore a small fanny pack containing a chemo pump that pushed a low dose of 5-FU. It took a little getting used to, especially when it came to sleep and bathing, but we made it work having to wear that pouch all the time. Now as for the surgery, at this point we're at a crossroads on whether to do the surgery or not. The primary reason is the fact that I'm told the affected lymph node in my collarbone can't be removed because its proximity to the main artery, which makes it very dangerous. So the best they could do is remove the esophagus and move my stomach up, but then take the chance that the cancer could come back because the cancers weren't completely removed from my body, that being the one in my abdomen and one in my left collarbone. Or we forego the surgery and see if it returns, since I will be on a regular regimen every 3 weeks of Herceptin anyway. So Dr. Ballard, my oncologist, is discussing with MD Anderson, the Piedmont Tumor Board, and others to isolate what would be the best recommended course of action and what we should do next. During the last few weeks of my treatment, the fatigue was enough that I had to go on short-term disability. It was a suggestion that turned out to be a very good call, as I started to notice that the fatigue was making it hard to keep up with my work duties. Surgery is the next step. I am told it will take 6 hours for the surgery and up to 4 to 6 weeks of recovery. So that's yet to be determined. If I can offer any advice to anyone going through this, it will be this. Even through the physical side effects and the emotional roller coaster, try to stay focused on the goal and not the steps to get there. I know it's easy to say that, and for each person their experience is different, but focusing on the goal has helped me immensely. Also, if possible, make sure you're not going through this alone. If you have a significant other or someone you can depend on during treatment, you need to talk and work things out. Depending on the type of cancer and treatment you're going through, the demand for support from your partner is going to be very important. Not only for the care from the side effects, but help with appointment scheduling, discussions with the medical teams, possible transportation needs, and most of all, being there when needed for emotional support. Partners, stay strong. You are very needed, even if it seems the support is draining you. At certain points, you're going to hit some lows, and you're going to have to find a way to keep on going when you think you're just too tired to do it. When I hit those lows, it helped me to reflect on something my brother learned from his father-in-law, who suffered through cancer for 2 years before it finally took him. When there were days that he just didn't have enough strength to get up and do what he wanted to do or needed to do, he made sure that he sat up out of bed and at least put his boots on. There's something very strong and significant in just being able to sit up and put your boots on. An action that on any other day we wouldn't think twice about would appear trivial. Whatever works for you to keep your hope, your will, and your strength about you, and you should hang on to that. I personally would like to thank those that have been instrumental in my direct support. My wife Lisa, who has been incredible and amazing throughout this experience. I have not wanted for anything, and she tirelessly made sure everything was taken care of. Also, my 2 amazing children, my parents, and my siblings. I would also like to thank those who have helped me stay positive and motivated, which includes my very talented band members and a small number of friends and co-workers that are aware of what I'm going through. My boss has also been incredible and flexible with my schedule with work during the treatment, which we appreciate more than he will ever know. You have all been amazing throughout this, and I thank you from the bottom of my heart. I may post follow-up videos once we know more about the next course of action. If I have the surgery, once it's over and I'm far enough into my recovery time, I'll share my experience. I hope the best for you if you're going through this, or if you're the person who will be there for a loved one that's going through it. Try to stay positive and motivated through this challenging time. It does make a difference. Thank you.